Hi, my name is Mariana Bergonzoli, and my news report will refer to topics such as the availability of water, hand washing facilities, and hygiene in times of COVID-19. So, first, a little bit of context. As we already know, COVID-19 is a new form of coronavirus similar to that of SARS that also started in China a few years ago. It is transmitted through direct contact with infected people, generally through respiratory droplets such as coughing and sneezing, or touching infected areas and then touching your face. The WHO has been really clear in terms of the preventing measures, such as staying home, which is the total lockdown we're living, covering mouth and nose when coughing or sneezing, cleaning frequently the touch surfaces, and really importantly for the topic discussed today, washing hands often with soap and water. According to the United Nations, about 40% or its equivalent 3 billion people around the world do not have access to basic hand washing facilities with water and soap available at home. Of those, 1.6 billion people has limited access, which means they lack either water or soap, and the remaining 1.4 billion people do not have access to neither of them. Is also relevant due to the fact that every year about 297,000 children die from diarrheal diseases. This because they do not have access to safe drinkable water and because they precisely do not have the access to good hygiene and hand washing facilities. According to the following chart retrieved from Our World in Data that shows how until the year 2017 not having access to hand washing facilities caused the death of about 707,000 people. Poor sanitation caused the death of 777,000 people, and unsafe water sources caused the death of 1.23 million people. But why is this all relevant? This topic started calling my attention as I read the page of BBC News and saw that a first world country such as the United States has been struggling with the supply of this basic need to the lowest income population. According to this news, about 15 million households in the United States face water shutoffs annually due to lack of payment of water services. This has caused public issues that has left these people completely exposed to the virus. According to the Bureau of Labor Statistics, up to March 2020, the U.S. employment rate had increased to a peak of 4.4%. Taking into account prior news reports seen in class and how COVID-19 develops in such country, it is expected that unemployment increase by May. This means that less people will be able to cover all the expenses at home and might represent a higher possibility of water shutoffs that furthermore means less possibilities to prevent the virus. According to The Guardian, the highest shutoff rates were concentrated in southern and rural states including Louisiana, Arkansas, Florida, and Oklahoma. The hardest hit towns include New Orleans and Detroit. If we know the chart presented to dates of Monday, April 27th, Florida, Louisiana, Michigan are listed as one of the most affected areas by COVID-19 and at the same time are regions that, as mentioned before, have the most cases of water shutoff on the country. And what about Colombia? La Guajira is one of the most affected regions in our country. It has struggled with lack of access to safe water for years, and many institutions such as the World Bank, the United Nations, WaterAid Colombia, among others, have referred to the issue and have tried to tackle it by implementing donations, financing, and investment on this region. According to Arguelles, a WaterAid Colombia member, quote, "The Wayu people do not have access to water, sanitation, and hygiene, and therefore they do not have the luxury to stay home. We have to respond to their reality." This was said according to the nowadays crisis of coronavirus. La Ruta del Agua is a program that was born in 2014 with the objective of collecting water and food for the children of La Guajira. However, in recent days, a Wayu leader spoke on how, due to the difficult situation of the virus, they are no longer being helped by this program as they cannot reach the areas, and the population has been recurring to other solutions such as blocking the roads to manifest their need for food and water to survive, such as would happen in La Troncal del Caribe. Now, having all these topics in mind, how does all of this relate to the SDGs? First of all, the principal SDG it is linked to is the sixth, which is clean water and sanitation, as it is the one that provides a framework of objectives within having good access to water, clean water, safe water, sanitation, hand washing facilities, etc., for not only vulnerable areas but the entire globe. It is also related to the third SDG, which is good health and well being, as well as health security. Because, as mentioned before, not having access to clean water may cause easier transmission of infections and viruses due to lack of hygiene. Lacking safe drinkable water and the basic system of sanitation are the cause of lots of deaths annually, as I mentioned before, and as we could see on the graph that was previously shown on the video. The third SDG that relates to this topic is decent work and economic growth, as well as economic security. The increasing unemployment rate panorama in many countries due to coronavirus and its effects on the global economy has left a lot of families without the possibility to afford water services. This, for example, in the case of the United States that was exposed before, there is a really high unemployment rate and a lot of people living in poor conditions, which creates more shutoffs in the country as well as less possibilities for those families to tackle or avoid getting infected by the virus. And last but not least, also, no poverty relates to this issue as it is the poorest part of the population that do not have access to these services and find themselves without the tools to be more prepared and protected from the virus, which makes it a population in risk. Besides knowing that, for example, other factors have been affected, such as education, because poorest sector of the population do not have easy access to virtual lessons, etc. This opens up the gap of inequality and it avoids or do not permit us tackle this objective properly. The problem of water availability and sanitation has affected lots of communities around the globe, going from low-income populations to first world countries. Since lots of years ago, kids have been dying in Africa because of their bad living conditions that involve lack of water and hygiene. People in places such as India need to walk hours to find some water. Regions like La Guajira, where kids die each year because of droughts and no access to clean water. And now, first world countries such as the US having water shutoffs in the middle of a pandemic. This is a problem with which people have struggled for years now and that doesn't concentrate in a specific place, but that transpasses borders, which makes it hard to reach and tackle. Now, I leave you with some debate questions that I hope you find interesting. Thank you so much for watching, and I hope you enjoyed the chosen topic.